my Ministry of Health colleagues. I would like to start off by extending condolences to all those who've lost loved ones as a result of the passage of Tropical Storm Erika. And would also like to remember as well and keep in our thoughts those who've lost property and who have otherwise been displaced by the passage of the tropical storm. Now, with regards to the response of the Princess Margaret Hospital to the passage of the storm, the first thing we did was to adjust our operations, and that included the cancellation of non-emergency or elective type services. So that would include things like surgeries that were not urgent, as well as outpatient clinics. And these were cancelled so as to allow freeing up of resources, both human and otherwise, to deal with urgent situations. We do hope, though, that by next week we can resume or move towards resumption of normal activities, going back to regular surgical lists and regular outpatient clinics. The hospital also provided support to our primary healthcare colleagues by deploying some of the doctors who are actually stationed at the hospital to some of the out districts. As you would have been aware, a number of the health centers, the out districts, were not able to access the hospital, and as a result, the workload in those areas would have been significantly increased. And so we felt it was extremely important that we provided additional support and medical personnel. So doctors were deployed to those various health centers. The hospital and the central medical stores continue to work very closely with the primary health care services, the various health centers, in ensuring that supplies, medical supplies of wide range medications, etc., are sent on a very regular basis and as is needed to the various health centers. So we're making sure that things do not run out in the districts. We've also made some provisions for patients who are high risk to allow them to be on the hospital compound, and we speak specifically of the dialysis patients. As Dr. Johnson alluded, we have patients who are dialyzed up to 3 times a week, and it would have been extremely difficult and probably impossible for them to keep going back and forth, again because our road network has been so significantly interrupted. With special circumstances, we of course have special demands on staffing, and we are very pleased to inform that we have a pathologist from Grenada. Services were very willingly offered to help us with our pathology department, in particular the postmortems that we have to do that are arising as a result of this disaster. We also had a group of Cuban volunteers coming in yesterday, and that included 6 family physicians. They're currently receiving orientation at the hospital, and we're hoping to deploy them to the district health centers to assist and work alongside the district medical officers. From Cuba, we also have an anesthesiologist who remains assigned to PMH, as well as an epidemiologist who is working with our national epidemiologist, Dr. Ricketts. We've had as well 7 nurses from Cuba who remain at PMH, and we also have 6 nurses who arrived today as well from the BVI, and they too will be deployed throughout the healthcare service. I must say, on a daily basis, we continue to have offers from literally all over, offers of both medical supplies as well as medical personnel, and we're constantly processing those offers so that we ensure that we keep up with the demands on the ground. And I would really like to use this opportunity to thank all our partners, and those are both old partners such as PAHO, as well as new partners. We've created a lot of new relationships since this disaster, for really coming on board and helping us as a ministry to continue to provide much needed service within the health sector.